Community Collaboration in a Crisis webinar. I do want to let you know that we are recording this event and we'll share it once it's complete. I'm Jessica Smith, the Deputy Chief of Business Development with The Connection. And before we get started, I just want to say thank you on behalf of our team. We know that you're busy and there's a lot going on, and we appreciate you taking the time being here. We acknowledge that as human service providers, we have a tremendous responsibility serving some of the most vulnerable individuals in the state. And I think that this crisis has made that responsibility very clear, and we need to respond to that. So we thought we'd bring you all together to have a discussion and do what we could to help. As a team, we've been talking a lot about collective grief. And when we think about grief, it's felt in small ways, like maybe a project that you poured, months and hours of work into, and you feel that lost momentum, which can be really tough to take. But there are certainly heavier ways that we feel grief, like maybe a difficult decision that you might have had to make to furlough staff, or knowing someone who is sick, unemployed, or working on the front lines and worrying about them, or just the incredible weight in knowing that we are going to come out the other side of this, and we will, but we're going to come out forever changed. And we really don't know what that's going to look like. And uncertainty can be really difficult. We're grateful you're here, and we really hope that this conversation is helpful to you. Our CEO, Lisa DeMattis-Lapore, would like to welcome you as well.
Good morning, everyone, and thank you so much for being here. I want to welcome so many valued partners that are on our call today. And as Jessica said, we're so grateful that you're here today. And I want to extend my gratitude to all of you right now, because I know that the work that we all do is so difficult in the best of times, but during these unprecedented times, it's become even more difficult for the many reasons that Jessica said, but just because we're all trying so hard to keep our agency going and also, of course, serve the most needy in Connecticut. And all of you on this call are related in some way in doing such great work, all unsung heroes for folks in Connecticut. So thank you all for being here. We hope that today we'll be able to come together collectively during this crisis, but also we're grateful for the partnerships that we have with you, and we look forward to our continued collaboration and hope that we will be able to continue to do webinars like this, to work together, to offer support, because during these times we need to be even more collaborative than before. I want to just really take a moment to thank my team, my executive team, Beth Connor, my Chief Administrative Officer, Kathy Savino, Chief Program Officer, Steve Absher, my CFO, and of course, Jessica Smith, Deputy Chief of Business Development, but also Allison de Blasio, who is our Director of Communications and Development, and Todd Hawk, who's here today for our Director of IT. It takes a village. So what we'd like to do is talk to you today about how we can support and work together in the collaborative effort. I wish all of you strength during this time. I know that together we can get through this, and we will. We are here as a resource, and we want to collaborate as much as possible. So without further ado, I'm going to say thank you once again. Be healthy, stay well, and I'm going to turn this back over to Jessica. Thanks, Jessica.
Thank you, Lisa. So in thinking about how we might be able to help, we had an intention for today to kind of follow the deep commitment that the Connection has to community collaboration. We really do believe that together we're stronger. And at the Institute for Innovative Practice at the Connection, we kind of have this through line where we look at all problems and believe that if we share our challenges and we take a look at best practices, we can solve some of our biggest problems. And so that's sort of the lens that we take. And through community collaboration, we can do those three things. We are going to offer you free resources in response to the things that you share as challenges. Anywhere we can help, we will. And we will also, as I said, provide the roundtable replay so that any information shared you can go over that at another time as well. I would like to take just a moment and provide an overview of the connection for context. We are a rather large statewide human services organization. We have nearly 500 employees and 46 programs across the state. We have a fairly diverse service mix. Those areas include family and child services, foster care, young adult services, housing services, and adult services, including addiction treatment, behavioral health care, and community justice. Most importantly, though, in terms of context for who we are, we do offer essential services. And again, it's never been more clear how important those services are. The ones we deliver, the ones you deliver. We have lives entrusted to our care. And so when you look at underneath those categories, that service mix, we provide residential beds to over 430 individuals. We have emergency shelter, transitional and work release programs, women and children specialty programs, and even our professional development and training became really important when we did an analysis of our services and what we were going to need to do in response to the crisis. It became really clear that some of the training we provide to our staff is also essential in the sense that it couldn't stop no matter what was going on, even a global pandemic. So we had to be nimble and use adaptive leadership skills to kind of pivot the organization, which we'll talk about today. Some of those essential services that are provided in the training department were Narcan training for our staff that work in residentials and CPR training. If we're onboarding new staff, we need to make sure that they are trained. So safety in terms of COVID was really important and we responded, but also maintaining the measures that we have in place now in terms of training for safety, those needed to move forward as well. So what did we do? We did what everybody did in the beginning. In early March, the executive team was closely monitoring COVID and they were meeting regularly, but that was our existing executive team. They were watching the CDC and the World Health Organization and of course all of the coverage on news media outlets, just like everybody else. But I think you could probably all relate to the fact that there was a point where we realized we were gonna need to do something. We had hit a threshold. So quickly in response, Lisa formed a task force that included our Chief Financial Officer, Chief Program Officer, Chief Administrative Officer, and our directors of quality and HR. That team meets daily, which is a really important point. They meet at the top of the day and at the end of the day, and they do that 7 days a week. So they've gone the duration through the crisis, communicating about all of the new information that's coming through. I'm sure you share the feeling of keeping the pace of the information is really challenging. So that structure of having the task force and having them meet twice daily, 7 days a week, has been really important. We did create a unified communication strategy, which I guess can sound intuitive, but doing so in a larger organization can present challenges. So by formulating that core task force and they're taking in the information, making decisions about what that information means and how we were going to act, we could then create a plan of attack, so to speak, on how to disseminate that information across the entire organization through our leaders who need to feel supported, like they understand, you know, why a decision was made, what it needs to look like in the day-to-day, and then communicate that down to their teams and programs across the state. The other important element here is that our CEO and CPO have been in regular communication with our funders. I can't stress enough how important that's been. They talk about things like capacity and staffing ratios and various protocols that we were using for admissions and things like that, which I'll get into later. But making sure that we were on the same page with partners and funders was really important. And then sharing with our teams why particular decisions were made, how they were made with the input of the funder, with our state partners. That has gone a really long way to give context to sort of this flurry of information that has happened. We also did webinars. So of course, Lisa sends regular email communications, as does our Chief Program Officer, to the programs. But we've done some webinars that went organization-wide, and those have been really successful. We've gotten a lot of great feedback about how helpful it's been. We do use Microsoft Teams as our platform because our organization was on it. So getting people comfortable with that and then logging on and hearing directly from Lisa what is going on now and what it can be foreshadowed at least a few days or weeks. I feel like we're all living day to day or week to week, but in the future. We've had a great response to that. We also posted to the website public information for relevant program adjustments so that anyone seeking services or has a loved one in services could know what is going on. And we compiled a list of resources for the community to access as well, which I think can be helpful. There's probably an abundance out there of COVID information, but we do believe that we have a sort of constituency, and we are committed to making sure that the information is digestible and accessible. We had a sort of transformation happening at the speed of light, and we do have our director of IT on the call if you have specific questions there. We absolutely could not survive and respond without technology. And so like many of you, we had access to technology. It was adequate. I think the connection does a nice job, but the needs went through the roof. And so we had to scale up our IT capabilities very quickly. And some of the things we had to do in that area were increasing our VPN bandwidth. So when people were logging on to our VPN, we needed to make sure they weren't getting kicked out. That could be quite frustrating. So we did that. We had to add additional licenses, which of course came at a cost. We deployed computers probably at the speed of light. I think anybody who had a spare laptop was willing to share. We matched people with technology that worked for them. And we ended up implementing telehealth, which we were grateful that the state of Connecticut opened up those guidelines, and that can present some significant challenges as well. I'm sure you may have questions about that. We did use Microsoft Teams, and we can talk to the extent that it's helpful to you. We can certainly talk more about it. But we do have clients who are receiving services through Teams, which is HIPAA compliant. And again, that's no small feat either. For many organizations. Of course, safety is of the utmost importance. A ton of energy, technology, and safety have been a real area of focus. So our CEO has been working with other CEOs across the state to help network and source PPE. That in and of itself is incredibly important, both for the health and safety of our staff and clients, but also I think the sanity. It's incredibly scary to this scarcity mindset that there's just not going to be enough. There's not enough PPE to keep me safe. There's not enough food. Everyone worries about that. There's not enough period to get through the crisis. And so Lisa being able to talk openly on her webinars about her efforts, her very creative and admirable efforts to get PPE to our staff went a really long way because they had what they needed. And I do believe that their calm response to the crisis has been kind of rooted in understanding that the organization is behind them and here to keep them safe. I had mentioned before that there were various protocols that we had to put into place because of the lives entrusted to our care. So we worked with our funders and we came up with admissions protocols, screening questions, temperature monitoring, and overall education for our programs to make sure that they had the right information about COVID and what the symptoms are. There was such a flurry in the beginning, and probably still is happening now, around the symptoms, the risk factors. And so we wanted to make sure that we were clear and concise and people felt like that information was digestible and they could apply it. So we worked with our QA team and our CPO to get that out to the programs. Again, when someone shows up at your program and has hand knitted masks for you or has sourced, sanitizer from, the deepest corners of the state of Connecticut and delivers it to your doorstep, that we've gotten a lot of positive feedback about the heartfelt thank yous, because we know that there's a very sad shortage there. We had to adapt too in terms of safety to legislation very quickly. So our HR department had to work on the CARES Act and interpreting that and making sure that our employees could stay home when they needed to if they were symptomatic or they had a family member impacted. That goes back to our communication strategy. So the team is digesting that information, making sure it's clear, communicating it back out to our employees, and all of these things sort of work in a synergistic manner to make sure that we're not spreading COVID, we're keeping people safe. So adapting quickly to that legislation was really important. It was another sort of critical pillar. I do want to say, just in terms of safety too, safety is about not spreading COVID and making sure our staff and clients are safe. And this whole stay home, stay safe idea in a residential program was unprecedented territory for us. But we also needed to stay safe from cyber attacks. So going back to IT, we were hearing all over the news, some of that information we were filtering in through the task force was that some pretty, unsafe, unsavory things were happening with people working remotely. So our organization was at risk, much greater risk. And we wanted to make sure that we armed our staff with the information that they needed about how vulnerable we were and what they could do to take extra precautions and safety in that area as well. So we made sure that there was information being sent out via email, and I will talk in a moment about a training that we provided. So business as usual. It felt like in a crisis, everything stops, it comes to a complete standstill. And we needed to focus on the crisis, of course. But because we have the task force and we're taking in the information and doing some of the things that I just talked about, we were able to also look at some of the projects that we had and convert them to virtual platforms. Again, as Lisa said, it takes a team, and it certainly takes a village. So some of our business partners, some of our statewide partners, some of our funders, we work together to come up with measures that work at the program level, but also in terms of like agency-wide projects that we didn't want to let go of. So for example, something that is notable to me in terms of the scale of the crisis and still being able to accomplish some things business as usual is our HR team had worked for an extended period of time on a new performance appraisal tool and process. And so when we looked at that, it was ready to launch right, I think, in the middle of the crisis. We said, well, we don't need to lose steam on that. What we can do is do a webinar, provide that training on Teams, and then we can not lose momentum. People can be on the new performance appraisal process, and we wouldn't lose our target of July 1 in terms of having the new evaluations in place. I think that's really important because staff needed to see that we were stable enough to maintain business and that they were going to be evaluated in this new manner, which people were kind of getting excited about, that was fair and equitable and easier to use. So keeping people sane and making sure there's some sort of ease in the chaos, it was important to do that as well. Our training department, we had just launched our spring catalog full of new trainings and needed to pivot to offer online classes, which we've been able to do. So that took some strategy and some operational changes to make sure that the trainings that we were set up to offer and we had people registered for could still move forward. Even though they might not be deemed essential, we had a lot of interest in them, people asking what was going to happen. And so admittedly, in the beginning, it was sort of like, well, they can't be done in person. And we thought this would be a 2 to 4 week kind of thing. And so we had just sort of teed them up to be delayed. And then quickly we're able to adapt and start offering them online, which has been wonderful. And we've received some great feedback, which we're grateful for. The last thing that I want to note here is that we did do some compliance training, as I mentioned, because of the increase in cyber attacks, as well as the vulnerability for us in trying to maintain HIPAA compliance when so many staff on our workforce were working virtually. So we did deploy a training through our e-learning system to make sure that people had the right information. We implemented that early, and that was really helpful. A word about funding. So, of course, our organization seeks, funding through grants, statewide or federal grants. We had some that were submitted and everything came to a halt. We either got notification, like many of you, that they were going to delay the decision process. We were also writing grants that hadn't been submitted yet. Those were delayed. And so our team, we do meet regularly, of course, in this area, but we needed to pivot our focus as well. And so then follow the slowdown of grant funds, with the influx of COVID funding, which is wonderful, but it's coming from everywhere. And so we needed to get thoughtful and be really precise about what is it that we need. So we shifted our focus to reviewing those opportunities. I'm sure like you did the same. We went on some webinars and we tried to understand the landscape, but it seemed really important to us to write an impact statement to sort of get our story straight about, how did COVID so far, how has it impacted our organization? What can we forecast in terms of impact? Getting really clear about tracking those expenses, and then writing something up that we can draw from so we have a very clear understanding and can be very thoughtful about the funding that we ask for. Where is it most needed? That was tremendously helpful. So, the impact of the pandemic is unfolding for all of us. It's unfolding. It's an active thing, and we want to hear from you in terms of what is working, where are you most challenged, how could we help? We'd like to open that up to discussion. We're going to ask that webinar participants use the Q&A function. If you slide your mouse up somewhere on the periphery of your screen, I think it's different for everyone. For me, it's at the top, to the Q&A function. You can submit your questions there, and we will answer them as best possible. And we have, as a reminder, we have the members of our executive and core team on the line. I'm going to ask that they use the raise hand function so that we can unmute you and you can answer the questions live as well. I'm going to just make some changes on my screen so I can see the questions coming in. I think one important thing to share as a reminder is that we have many of the things that we talked about today, we have them written up in protocol format, and where we, any other strategies or things that we've implemented, we would be more than happy to share those things with you. I'd really like to hear maybe just what's been challenging, what you see sort of in the future coming up. Let's see. Charles, I see that you submitted a question and I'm absolutely happy to answer. I just don't see the content of it. I don't know if you want to type again and you can send it in, and I'd be happy to answer. And if that doesn't work, maybe Allison can unmute you. Gary, thank you for your comment. That's very nice. Allison, do you want to unmute Charles so he can ask the question? I'm not sure if the Q&A function isn't working. If it's not, you can just type that in and we'll unmute you.
Oh.
Hello.
Hi, how are you?
Well, thank you. How are you?
I am good. I am good. And I work for the Middlesex Chamber. I do the Recovery Employment Program.
Mm-hmm.
And so far, since I've been working from home, I have managed to, find 3 people gainful employment.
Mm-hmm.
However, they were scheduled to be released from the programs which they were in. So they didn't have a hard time getting out. But now that I'm running into the obstacle of finding people jobs, but are you allowing the clients from your residents to leave and to go out and to come back from work?
That is a great question. That's a great question. I think we have Kathy Savino, our Chief Program Officer. She's probably best prepared to answer that question, and Allison can unmute her so we can get you your answer, Charles.
Okay.
Okay. That's a great question, Charles, and one that we really took careful consideration on, understanding that we didn't necessarily want to obstruct or delay our clients from gainful employment, particularly when their time with us is limited. At the same time, we wanted to do our part in ensuring that we were being diligent in terms of the spread of COVID within the community and in our programs. Specific funders have specific guidelines for this. So for instance, in many of our Department of Corrections work release programs, work is a primary and essential function of that program. Right. So we have been allowing individuals to continue work if their employment was deemed essential by the state. And we have been doing our best to ensure that those folks are continuing to engage in their employment. For those people who were not employed, depending on the program, we were a bit more careful about that. And our work programs were a little bit different. We've been instructed that we can continue in some of our other residentials, maybe our substance abuse treatment residentials that have community access. We've sort of limited that at this point because we do not want to introduce a potential infection in the program when that is not a core function or competency of the program. It's just an ancillary side part. So that's really how we've been guiding our decision.
Okay, all right. I mean, that's a solid answer, because like I said, I've also dealt with some other agencies, and I have gotten the clients, positions, but they were told that if they were to leave the program, then they would not be allowed to come back in.
Right.
It's like throwing me like really in a catch-22 here. Like my job, but yet at the same time, not being able to do my job.
Right. I think, Charles, that goes to some of the grief too, right? We're so deeply committed to the work that we do. Our services are absolutely essential. And yet there's been this sort of, Allison and I have been talking about the collective grief, but also sort of this analogy of a tanker ship, having to rotate 180 degrees and not tip over. So it can be really difficult to navigate. I think what Kathy said is sort of the purest answer we can provide, that in the programs where it is a core function of the program for them to receive job training or vocational services or whatever it may be, we have not disrupted that. But where it is not, we have to kind of balance the risk benefit. So that was part of the collaboration with funders, figuring out, what is the purpose of the program, what are the target outcomes, and how do we balance that with safety? So thank you very much for your question, Charles. I appreciate it.
Absolutely. Hi, Beth. Hi, Lisa.
I have another one. Have any of your facilities been impacted with COVID-19 infections involving staff and or residents? I think I will let, I don't know if Lisa or Kathy want to answer this question, but we certainly can share information about impact in numbers.
Am I live here?
Yes, you are.
Hi, folks. Hi. Well, I feel like I jinxed us, because we've been,
I know, me too.
right? Because we've been dancing through the raindrops, and I think Sunday I was saying, oh, we have not had any positive cases. Well, that really changed. We had one client test positive, and we've had a staff person test positive.
Mm-hmm. Right. So at the time of the scheduling of this webinar, we were at 0, and of course, like anyone, feeling really proud of that and thinking, wow, these processes, stay home, stay safe, it's working. And unfortunately, like everyone else, we've had one staff and one client since we scheduled this. Thank you for the question. With staff working remotely, what are some best practices for supporting them? We actually have some resources and some information on security, so we could share that. But also, one of the things that I've done with my team is making sure that I'm communicating with them regularly and I'm really clear about what the priority is. I think that, the pace changes when you work from home, how you go about your work. Like, I don't have 2 screens at home. So how you sort of stratify what's important, I think open communication is really critical. I've used Microsoft To Do with my staff so that we can say, okay, these are the things that you're working on. You can complete them when you're done, so I know what's happening. There are some very frustrating barriers. So if there's technical issues, that I don't know about you, but if my computer's not working, my blood pressure goes up immediately. And so one of the most important things that has happened is that centralized communication strategy. So every time Lisa sends an email or does a webinar, or Kathy communicates as Chief Program Officer with her teams, there's this sense of, there's not a hurriedness, and there's no crisis mindset. It's, we're all in this together, it's going to be okay, the expectations are reasonable, and these are the things that we have to do. So, what business development in our team needs to do is very different than what a case manager in a residential program needs to set as the priority for the day. And so how we support them is through a compassionate stance and through information, making sure that they don't feel unsupported or like they don't know what's going on. Technical stuff, Todd he'll be humble, but he has worked night and day with his team to make sure that everyone has what they need and no one is going to suffer from damage from high blood pressure because their technology is not working. And as a reciprocating, our staff have been calm and polite and generous. So I think it's sort of a feedback loop. That we are clear and transparent and calm, and then when they experience issues, someone is at the ready and responsive quickly, so they don't feel alone. They're not worried people are going to criticize or think they're not working hard. And the last thing that I will say, and our team can certainly jump in to fill in any area that I might have missed, is that the use of virtual technology, so Microsoft Teams, I think has helped us feel a little bit human. I don't know if your organization has a platform like that. We do offer consultations, so we could help you implement anything that you needed. But we have been able to see each other's faces and get to know each other's kids and cats and environment in a way that has not really ever happened much before. And so there's, again, this humanity and this humility when your cat is in the background, or something unexpected. My neighbor's Amazon pantry stuff got delivered to my front door in the middle of a meeting the other day. There's just been a genuine sense of kindness and just goodwill. And so people are stressed out, and knowing that having the information and having that compassionate stance along with technology has been really important in terms of helping us maintain some sanity. I don't know if anyone wants to add anything before I get to some of the other questions. Can Todd speak to some of the organization, some of the challenges working remotely as an organization? What have you experienced, Todd?
Well, we've had a few adventures in the last few weeks, we'll put it that way. Everything from suddenly the majority of our staff worked from offices. They worked on desktops. How do you suddenly equip them when there are shortages everywhere to work securely from home? Fortunately, we had a significant number of machines that were slated to be recycled soon that we still had. So we were very fortunate that we were a little bit slow on that project. We had about, I think it was 80 machines in 3 weeks that we deployed. And we started thinking through, as soon as we had staff working remotely, what are going to be the consequences of doing this? And what I mean by that are things like, are there any applications that don't work well on the VPN? Are there any options for things like phones? Who's going to be on the other end of the phone if somebody calls us? If we're not in the office, we didn't have anything equipped at the time. And I think thinking through other real world scenarios, what happens when your password expires and you suddenly aren't able to change it? What happens if you lock yourself out of your account? Do staff really know how to ask for help in a good central way? Does IT know how to track and triage those issues appropriately? So some things we did, thankfully, were things like we deployed a self-service password reset a few weeks ago, so that staff working remotely, if they're locked out, if their password expires, they have the ability to reset it
right.
themselves.
Mhm.
And that's great for the agency, because when this passes, that was about 30 to 40% of our tickets in a given week. So we've also reduced the amount of work we have going forward. But I'm
Thank
happy
you,
to
Todd.
answer any other specific questions if anybody has them.
Technology's been so important, and Todd's a great resource that we're absolutely happy to share. Thank you, Todd. I know that Kathy has something to add, so I want to make sure she has the opportunity, and we have 2 more questions that just came in as well.
Okay, actually, I wanted to add something on a previous question that really just talked about with staff working remotely, what are some best practices and how we've been supporting them. And I thought Jessica did a really nice job of really conveying the core tenets of how we've been trying to navigate this with all of our staff. And I think what really we had to help people understand is that, you know, while we talked about our residential programs or some of our work release programs for individuals who are currently residing with us, all of our services at nonprofit organizations are deemed essential. So we didn't have the luxury of shutting down any service that we do. Now, we might be working in a modified way, but of course we have to meet the contractual obligations. And so sometimes that can even be more challenging. And so we had to really understand that our staff are being asked to do a very similar job under very different conditions. And that we had to be able to provide support. We learned quickly that all of a sudden, a lot of people, I guess, including us right now, but want to do webinars. And a lot of communities are doing webinars in order for people to stay involved. And so we were hearing feedback like, hey, we are doing a lot of webinars here. So how can we streamline what we need to do? And how do we work around schedules of both our clients and our staff who may have children home with them? And, you know, so I think we had to do a lot of work initially, just helping people understand that even if you are working from home, your program is still deemed essential. And I think one of the things that right now we are working to support our staff and to really be thoughtful about is we will likely see some programs now that this has gone on for a period of time where their staff need to return to the office soon in some type of modified way. And maybe it's only for a few hours a week, but that some of those essential services that we provide to clients, we can't continue to do solely from telehealth perspective. So, you know, that's, I think, the next thing that we're really going to be working on. And unfortunately, fortunately, as we sort of move through this, there is an element of real things being very uncertain about when we return and in what capacity, and just trying to give people as much notice as possible. But I really think that it's been a balancing act and really helping people understand that all of our services and all of your services are essential, whether you are in a residential or not.
Right. Thank you for that, Kathy. I think that's really important. And it's gone a long way with our staff to help give that context, for sure. I have a question for Lisa.
Yeah.
It says, what do you think the long-term impact of COVID will be on human service organizations? And is there a bright spot?
Well, I always like to try to believe there's a silver lining in everything. I do, if you want to talk about positive things that I've seen already come about, is I've seen a huge increase of collaboration and communication. And I know that I feel like my days are actually more productive in a way because I'm able to attend so many meetings that I'm not in the car driving to try to get somewhere. So I'm able to I'm able to see my peers. I'm able to collaborate. I'm involved. Like today, we're meeting with some of you. And while it's hectic, I feel that I'm really as an organization much more involved in situations now and really have a larger voice than before. I've enjoyed being able to connect with my peers in a brighter way and really problem solve. So I think that's been really effective. I think that for sure we've realized that we don't need to be driving to meetings, and that we can have meetings like we are having today that are actually more efficient, more focused, better organized. It causes less stress. I wish it wasn't this pandemic that made us realize that. So I think that there will be positives that will come out of it. I think with regard to impact, none of us really know what the impact will be, but what I obviously believe is that folks are going to need our services more. That this is, while we will find some calm in the chaos, I think that even for all of us, for our families and for friends, and even in general, who may not be suffering with things that our clients are suffering with, that this is a traumatic time. I think it's taking us, we have to sort of take a step back and reevaluate our lives and the way we do things. But I also think that there will be an increase of services. I definitely believe that folks in Connecticut are going to need us more now than ever, and that our services are, we're not going to have a shortage of people needing, for all of us in the state, additional services and counseling and other things. I don't know if that's a bright spot, but what I do know is that all of us are very invested in making sure that we are taking care of folks, and that need is really going to continue. I think we're going to learn how to collaborate and problem solve in a better way. And I think that's what's going to come out of this.
Yeah, I couldn't agree more, Lisa. Thank you. I'm noticing that Gary sent a comment, and I was reading through it, and I do want to acknowledge, he closes by saying that, any way you shake it, technology is just not going to replace the effect of face-to-face, both with staff and with clients. And I couldn't agree with Gary more. I was listening to this great podcast the other day that talked about the importance of human connection, particularly friendship, and that the benefits of connection are, they far exceed the health benefits, of connection. Actually, they're more impactful in terms of keeping us healthy than not smoking. And so this idea, and one of the elements of that is eye contact, right? And like being in someone's physical proximity. So that to me, Gary, speaks to that idea of collective grief. And the losses are small and large, and they're compounding. So we couldn't agree more. I did go to the office. We've been doing very limited numbers, and I got to see some colleagues in person. And when I talked to Beth later that day, I said, I feel like a real person for the first time. And it really was just about seeing other people in physical proximity, of course, within 6 feet, right, Allison? But it did make a tremendous difference. One that I did not realize until I was doing it. I didn't realize the absence of that was having such an impact. So thank you for that, Gary. We're definitely all struggling with that, and I couldn't agree more.
I've been so grateful to see some of my staff. We've been, while we're working virtually, we are also coming into our main office. And I think I probably, thanked Beth 100 times because she came into the office with me yesterday. We needed to work on, some things, and just having that human connection and being able to see others. Todd happens to be with me today in my Danbury office. He's in the next room. So it is so wonderful, right, to connect with people. And that's why we're all in this field, right? Because it's a sort of this human connection. So yes, of course, we all need that. But I think when we ease back together, I think things will be very different. But you're right, Gary, we need that human. I'm looking forward to seeing you, Gary, soon, hopefully in person. But thank you for your feedback.
Thank you, Lisa. 2 more questions, and then we will graciously not ask to take up too much more of your time unless you have any burning ones for me. Also, here, do you find since the pandemic it's brought each of our programs closer and more willing to work together to accomplish the goal of serving the community? I absolutely do. As Lisa noted, there's been a tremendous sense of collaboration. We really are all in this together. It became very clear very quickly that the pandemic is not going to discriminate, and that any organization, is sort of an even playing field. We're all facing the same challenges. We're all working with the same, resources and shortage of resources. So yes, I have seen a tremendous sense of community collaboration, and even amongst programs. Before we had a confirmed positive in a client, we had one that was suspected, and the response that our leadership team had, but more importantly, the program staff, that they were able to follow the outlined procedures so carefully and clearly. It was really admirable. That's a very scary time. And the collaboration amongst the two programs in the same building, so across the organization, across the state, amongst other nonprofits, I have seen a tremendous sense of collaboration. And I do bring that back to that collective sense of grief. Sadly, there's really nothing more humanizing than, it turns out, a pandemic, and this sort of, mutual fear that we all have for ourselves, our families, our staff, and our clients. So thank you for that. We definitely do. We do see that. I do want to just reiterate that we've provided, just a very basic overview of who we are and what we've done in response to the crisis that we hope is really relatable. If there are details that you would like any protocols or processes, or to talk through how certain things have looked or how they've come to be, things I didn't cover, my contact information will be put up again, and I'd really encourage you to reach out. We are happy to help in any way that we can. Our Institute for Innovative Practice at the Connection does offer training to anyone, not just to our staff. So all of that information is on our website. And we have opened that up, as I mentioned, virtually. We do customize training. So if your staff need any specific training in response to the crisis, we have lots of things we're doing internally. We could certainly develop something and assist with your organization. We also offer consultation. So anything, like I said, in terms of technology or any other areas, projects you had in play, how to scale them to the resources that you currently have, or working on virtual platforms, we could help with that as well. So please do not hesitate to reach out. And thank you so much for taking the time. I know a couple people have said this webinar craze is not a joke. There's been a lot of opportunity to spend time on virtual platforms, and we are so grateful that you chose to be with us today. Thank you. We'll leave this up so you can have that information, and you will also get it in a follow-up email with a link to today's recording.
Thank you all so much for joining us today. We want to be here to collaborate together, so please feel free to reach out, and we hope that you and yours stay safe and well.
Thank you, everyone. Be well.
Thank you.